Hello. Today, my presentation is about accessing prenatal care through telehealth, providing medical care for moms-to-be. The introduction. So these are the benefits of accessing prenatal care through telehealth. Accessing prenatal care through telehealth has several benefits. It provides healthcare services for moms-to-be and families that struggle to be seen for in-office visits. According to a recent study by Manyati and Matsu, pregnant women in Africa have a low percentage rate of being seen for medical care. So when we think about that, we can also think about women outside of Africa and in our own country, the United States. How often are families not being seen for prenatal care, maybe because of the inability to be seen or to get to those appointments, especially post-COVID, now that telehealth is more of a thing that is now being used and implemented in medical practice. How can that service help families to get access to prenatal care? The target population for prenatal telehealth care would be families who currently lack prenatal care. So maybe they just aren't under any medical provider and could use some support in accessing prenatal care. Families who lack transportation. So those could be families in rural areas who don't have nearby medical practices, or families who don't have transportation. Maybe they don't have their own transportation or don't have anyone to take them. Low-income families, so families maybe who financially can't get around because of financial reasons or can't access prenatal care because of financial reasons. Teen mothers, because they're so young and need that support. And also families who lack health insurance. Oftentimes, virtual prenatal visits or telehealth appointments can be cheaper than in-person, just because in person they're providing much more hands-on experience that can be billed as opposed to those virtual services. Accessing prenatal care through technology. So technology has the ability to provide telehealth in a variety of ways, and that could be through a computer, tablet, or smartphones. If you think about it, we all have smartphones in this day and age, so it is easy to access those prenatal healthcare visits, and also just to have the ability to complete those visits in the comfort of their own home, in a space that could be maybe accommodating for them, such as a local park or their McDonald's. Wherever they would choose to have those visits would provide some accessibility for them. Telehealth services also allow for visits to be completed, like I said prior, in the comfort of one's own home. There are several benefits of prenatal telehealth services. The first one is there's an alternative to in-person treatment. So the ability to opt for virtual, maybe that is easier for you, or maybe a mom has limited availability with her work schedule, and maybe those virtual appointments will work best. Prenatal care is accessible for families without prenatal history, with prior history. So really reaching out to those families to provide those alternatives, to let them know that, there's another option, that they can actually be seen virtually. Telehealth sessions can improve prenatal care. So just being able to be up under a provider and to check in with a provider can improve prenatal care. Telehealth can serve as a connection to other community resources. So medical providers could also connect families to other resources in the community that they may benefit from or need in the moment. And prenatal telehealth care can be tracked to see how visits are going. So over the long term, how are these visits occurring? How are they doing? What could be tweaked? What could be changed? And this could also be used for further research in the field of prenatal telehealth care. So continuing on from the benefits of prenatal telehealth services, there's also a quicker access to medical providers. So maybe there could be something going on, or maybe a patient may have a question that they really want to have addressed. Instead of having to drive there or to have worry, they could access their providers instantly by logging into the platform. limited exposure to illness. So just the limited ability of having to be around other people. And lastly, there is no need for childcare for other children. So families who have other children in the home, sometimes they need somebody to watch them while they are going to access these prenatal appointments, or they have to take them to childcare. Having the ability to get these services at home allows for less spending with childcare and for children to not be disrupted from their home environment. I did include a video on prenatal telehealth that can be accessed at your leisure. But this video pretty much just talks about a local a clinic in the United States that provides prenatal care through telehealth. And the OBGYN is in another state, in a totally different state than the patient. But they are seen actually at home for a few days, and then they're also seen in the office with the nurse nearby in the patient room, and that patient has access to the provider, to the OBGYN, via computer, laptop, television screen to make so that the screen is big. It is very helpful because these families are in a rural area and they don't have access to any medical care nearby. So the doctors just talk about the grant that was afforded to them and how this program has really helped pregnant women and families in that community by accessing this service. So it is a really great video that I would encourage you to utilize and see. And here are my references, and I thank you for your time.